You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, holistic dentistry. More and more holistic dentists are popping up across the country. With us, we have Arizona's holistic dentist. He says that your dental fillings can be making you sick. With us, we have Dr. Meyer. Dr. Meyer, welcome to the program.
Well, thank you, Randy. It's nice to be here.
So let's start there. So dental fillings, the typical dental filling, can be making people sick.
They can.
How?
Simply, most of the traditional fillings that people have in their mouth are the mercury, silver mercury fillings, and those fillings have about half the content is mercury. Okay. Mercury is an acknowledged known neurotoxin, so neurotoxins are not healthy for us, and so they're poison to the brain and the nervous system. So that's but one component. The other component is that you have multiple mixed metals within the fillings themselves. That generates extra current. So you get electricity forming from your fillings going where? Close to the brain. So that is called electrogalvanism. I learned about that my freshman year of dental school, believe it or not. So we're taught don't mix metals together. And then by the junior year, we're actually mixing the metals together because clinically that works, but on the scientific side, we shouldn't do it.
Okay, now, you know, we have medical doctors that come on the show.
Yeah.
And all of them agree. They say, you've got to get those metal amalgam, is that what they're called?
Yes.
Fillings, take it out. That they're very dangerous.
Yes.
And there's even videos that you've made online about the vapors and
right.
how harmful they are. So a big part of your practice, they come in to get these removed?
That's a part of the practice, and depending on the day, it could be bigger than other days. But we see people do coming in just for that one reason, because they've often been referred or told by a health practitioner or a health coach who is more aware that your mercury fillings can make you sick. One of the things that we see are allergy expressions, so redness on the face.
Really? Just from your fillings?
Yes. Absolutely.
Now, I know you're not here to talk about the book, but you wrote the Holistic Dental Matrix in the book.
Yes.
So everything we're talking about today is in the book?
It's in the book.
Who should read the book?
Everybody. No, really. People that are concerned about their health. There are many people that are concerned now more than ever about what they're feeding their body. Would you rather have hormone-fed beef or free-range beef if you're a meat eater?
Good point, yeah.
Okay, would you rather have poultry, chickens and things that are free range or those that are factory farmed? Okay, same thing. In the past, we had very few choices.
When it comes to dentistry.
Dentistry and what we could put in teeth. We had, when I first started 37 years ago, we had only mercury fillings and gold, and that was basically the end of the story for back teeth fillings. Today we don't. We've got all kinds of options. So we have the materials that are better, they're more healthy, and you have a choice now. What's a matter that can go, you matter what you're putting into your body. You're taking high care of what you're putting into your body with your foods. You should have as much concern about what's going in dentally so that you now know that you have the highest, best and material that's going to serve not only the health of your teeth, the longevity of your smile, but be most helpful for who? Your immune system and you.
Okay, now I read your book. You asked me a favor to read your book.
Thank you.
And I thought, oh, this is going to be terrible, right? I have to read a book about holistic dentistry. It was
teeth.
a great book.
A book on teeth.
And I told you at the end of the book, I was like, wow, because I have one metal filling left. I shouldn't admit it. One. I have one. And I got to get rid of it. Because right? I mean, the facts are in
now
it.
you have a choice in dental materials. There are materials which are more healthy for you, for your immune system supporting your health, rather than deteriorating your health.
But are there really that many toxic materials the dentists are using, other than the metal or mercury fillings, that are toxic, that you're using every day?
Randy, there are. And there are adhesives. There are the composites. The white filling materials can be toxic to the individual who has the toxicity to them. But unless you know about that toxicity, you would just put them into the mouth, think everything's fine because it's not mercury, and they could be jumping out of the fire and from the frying pan rather, into the fire. Okay. And having a different response.
So other than that, what else? Other than these white filling materials, what else are you using that, or most dentists using that are toxic?
Well, the adhesives we just briefly mentioned, but the adhesive is the lining material that goes between the tooth and the filling material, or the from between the tooth and the crown that would be put onto a tooth. And that's in contact with the living part of your body, the tooth, and most of the time it's living. And that material can seep through the tubules, the little tiny channels which are in your tooth and go into your bloodstream.
Is that right?
That's
so
right.
as a dentist, the dentist has a choice between different types of adhesives to stick the crown onto the
That's right.
tooth. And you choose...
There are dozens.
Do you call it
Dozens.
biocompatible material? What do you call it?
We use that term, biocompatible. And what that simply means is that what is a material that's least challenging to your immune system? Because your immune system is different than mine. What may challenge you wouldn't challenge me necessarily, and vice versa. So there are thousands of dental materials which we have as a choice in dentistry. Composites, the white fillings we're just talking about, there are over 100 different ones on the market. They're not all the same.
Does
They're
it cost
different.
more to do all this? I mean,
It
to go to a
doesn't.
holistic dentist?
It really doesn't.
Really? Okay.
No. The only cost difference primarily is the blood test, which we use. We test, I mentioned that, what materials are going to go back into your mouth
that right?
once we take them out.
Okay.
Now, the physical placement of the filling materials is, I have only the same materials every other dentist has in the marketplace. It's the choice of the material for you that's going to make the difference. So, Randy, it's not just about the fact that in dentistry, I have to use the same materials that every other dentist has. It's that I'm going to choose for you based on a test,
Nice.
blood-serum compatibility test, the material that's least offensive to your body. And there may be a small list, but I don't now have 100 to choose from. I may have 5 or 10, okay, that are now for you the better choices. Rather than a detail supply person coming by and saying, gee, doctor, we have a special this week, and if you buy 3, you get 1 free. And now you've got, from the last deal that you had, you're building up an inventory of white filling materials, thinking that they're all created equal, and they are not.
And they're not. So how do you find a holistic dentist? Obviously, you're a holistic dentist in Arizona, but what do they call themselves? I know they call themselves, according to my notes, biological dentist, holistic dentist,
That's right. That's
functional dentist.
That's right. So there are a couple ways. We field calls probably once a day of people calling from around the country, because my name is around the country. Do you know somebody in upstate Wisconsin or in Pennsylvania or this in place? Sometimes I do, most of the time I don't. However, there are a couple organizations that are regularly acknowledged so that you can find somebody that's going to have at least a certain level of awareness.
So there's a big learning curve for holistic dentistry, right? Some guys are just getting into it. You've been doing it for many years.
That's right. I've been
Where do
doing.
you learn all this stuff?
We jokingly say that we learn this at motels on weekends. Because most of the stuff that we learn is not available in official ADA-approved dental schools or AMA-approved medical schools. We take principles from those disciplines and apply them differently. So we go into areas of toxicology, for instance, and we go into microbiology, different than some of the mainstream things, but they're just as valid outside of mainstream dentistry as within mainstream dentistry.
For the sake of time, I've got to move right along here, but as a holistic dentist, you're also using lasers to treat gum disease, this bacterial infection, bleeding gums, bad breath, loose teeth, etc. What are you doing?
And using the laser is a wonderful tool to use in eradicating the bacteria which are often associated with the gum disease process. How it's normally done is, if you think of peeling an orange, take the skin of an orange and just peel it back off the flesh. Now in a gum disease treatment, we can take the gums and we peel them off the bone. You got that picture? Then we take small little instruments and we scrape the bone, scrape the tissue, and then we sew the gums back up.
That's what like a periodontist may do.
That's right.
Okay.
Okay. So the use of a laser is so much more convenient and so much easier. And you just take this small little fiber. It's only the diameter of 3 human hairs. You got that? 3 human, little tiny thing.
All right.
So that's the size of the treatment area. It's only that tiny little thing, and we can eradicate selectively bacteria that are harmful to us, and the tissue that is infected can be eradicated microscopically almost. It's such a fine incision that you can have that treatment done and you're back to work in the afternoon.
Okay, so I just want to make sure I get this straight. So the way gum disease, severe gum disease is normally treated is you peel back the gums, they clean the area to get rid of the bacterial infection. Or you could go around the mouth in a laser,
Yep.
kill the bacteria without the cutting and the sewing and
right.
stitches. Really?
Yeah, so we're fond of saying it's a no cut, no sew technique. You don't have to cut and you don't have to sew. Those are two things which terrify people.
Now you call it energetic medicine in a way, or energetic.
I do.
Elaborate on that.
I use on energy. The energy's sunlight. Sunlight is energy. The lights that we have around us is energy. You can't see it, but we know it's there. We know it works. So in lasers, it's a really concentrated energy. When you were a kid, you took a magnifying glass and you put it on your hand and the sunlight, you focus down a little tiny beam and you says, oh my gosh, that can get really hot.
Yeah.
Well, scientists long ago figured out how to harness that predictably and have certain wavelengths. So it's been found that different wavelengths create different effects on the tissue. We can use that now in medicine, so we can do these wonderful, neat treatments without having the morbidity, the problems that people would have otherwise. You know, historically, periodontal disease is very painful and unsightly. It's disfiguring. You would see people coming out, their gums would be shrunk all the way back up because the periodontist would go in and remove the tissue where appropriate.
Some of the tissue.
Some of the tissue.
Okay.
Sometimes it was a lot of the tissue.
All right.
So that is.
So now it's laser.
It's kind of in the dustbin of history.
I have periodontal buddies,
Yeah.
board certified periodontists.
Yeah.
They swear by lasers. They say no more, just like you said. They say no more cutting, no
right.
more sewing,
It's no
no
more.
more cutting out a bacterial infection is what they tell me.
Right.
They treat it by going to the source. So that's what you're doing as a holistic dentist.
So I can, as an example, my laser also is great for eradicating herpes sores on the mouth, in the mouth, on the gums. It just 1-2 minutes of bathing the area, painting the area with the laser energy, that thing, the pain goes away almost immediately, and then it accelerates the healing by at least 50% or
You know,
more.
16 years ago when I first started my show, dentists were just getting into all of this natural stuff, and the other ones were saying it doesn't make a difference.
Yeah.
Now those same guys are saying, I never use metal amalgam fillings.
Well, it's curious because the people that will do the mercury fillings for others won't have that done for themselves.
So no mercury fillings at all in your practice.
No.
Are people still getting mercury fillings?
Yes.
Really?
Yes.
In Arizona?
In Arizona, and typically it's in the, unfortunately, the Medicaid practices, government-funded practices, military bases. There's no choice. You only get what you have available from the government.
So it doesn't cost more to get one of these type of fillings?
Not particularly.
These special
No,
fillings?
what was the problem back in the day when it started was is that the skill set, the skill level for the dentist to put in a nice white filling, a composite, was different than to put in a mercury filling. You could put a mercury filling in with your thumb. I could show you how to do it and you'd be proficient in 3 minutes probably.
Okay, now you tell me. Okay, good.
Now I tell you. So the composites are more technique sensitive. It's a different finger skill set.
Okay.
The new guys coming out of school, new women and gentlemen coming out of school, they are very adept at doing the white fillings. They're showing that. It was not part of our training, particularly back then.
But that's not enough according to you. You've got to do the white fillings that are
Safely.
biocompatible
Yes.
to the person.
Right. Now, fortunately, most of the people, you call the Whole Foods group, they're going to be ambulatory healthy and they'll accept a wide range of materials. Okay? There are those people I described as my second group. They're much more difficult. They have many more health challenges. Their immune systems are more compromised. They're brittle, like a brittle diabetic. So they're more fragile. We have to take a different, higher level care with them for sure, and be sure and certain that the materials as utmost that are going back in their mouth will be as supportive of their health as possible.
Now, you know, on our show, and we get a lot of emails on wellnesstower.com, but there is a crowd of people that the autoimmune people with allergies, people that are always looking to try to detox. Their whole life is detoxing from this, and they're trying to eat organic, and they're trying to do these things. Do these people that are in this mode, do many of them, would you say like 80% don't even know there's such a thing as a holistic dentist out there? Because they're so worried about putting organic things in their mouth, but then the dentist is putting toxic materials in their mouth.
So I don't know the percentage. I don't know if that's...
But there's a lot of people that don't know.
I would say there's a lot of people that don't know. And it's geographical. You're going to find people that are more in the heartland, for instance, compared to Arizona or California that have no access and no awareness to the kind of care that we're talking about. We have naturopaths, chiropractors, homeopathic
Arizona
physicians.
has a lot of this
We've got
integrated
a
medicine type stuff.
whole bevy of people that are in integrated medicine. So there's the messages coming around from a lot of varying sources.
Are medical doctors where you are starting to send you patients? Or do they send you patients?
There are, as well as chiropractors, naturopathic physicians, and acupuncturists. We have in Arizona, I think we mentioned, a wide diversity of alternative-minded healthcare providers. Homeopathic physicians, another one. They understand these interrelatednesses of health, dentistry, and some of the things that are in the book.
Okay, good.
Which there's a lot of topics in the book.
How else are you using the lasers? We've talked about to wipe out gum disease, the bleeding gums, bad breath, red puffy gums.
Right.
How else are you using them?
I treat chronic facial pain. I've used the laser successfully in reversing dead feeling in the jawbone, for instance. So if somebody had a dental procedure, it could be years ago, and it's kind of like that woodeny feeling on the face. 2 or 3 treatments, often that will totally reverse and reestablish that nervous feeling. Because what happens in that injury, the healing got stuck. It just froze, and it's just they're in a state of suspended animation. Those little mitochondria I mentioned, and they're just kind of waiting. So when they get that,
You give them a jolt.
they give them a jolt, that little jump start, then they start to wake up and the nervous energy starts to flow back through that nerve. The healing is now able to complete its process. There are sometimes things just, for whatever reason, they get stuck. And when they get stuck, it can't complete. It's kind of like reading the book. If you get stuck, if you're distracted, you have to go take the garbage out or something, you put the book down and you don't come back to it. You're stuck.
Okay.
Now something's got to prompt you.
Lots
like
of
me.
clinical stories in here of people that are getting better. I saw one of your videos. The woman says, I got my sleep back, I got my energy back, I'm paraphrasing slightly.
Yeah.
But are there really a lot of people that you remove their metal fillings, right? I'm calling them metal fillings.
Yeah, sure.
You give them, replace them with healthier stuff. You go around their mouth with a laser to kill this bacterial infection that you say is robbing them of energy, has an immune response. Are there people that say that by doing this, their life is better?
Absolutely. Case in point, I had a very nice gentleman several years ago that came in, and his complaint was his partial didn't fit. He wore a removable partial denture. And I looked at him and I saw really what the problem was kind of right off the bat. And then we get into his history. Very briefly, he suffered sleep apnea. He had just been to the ENT that cut his soft tissue off, and he was in worse shape than he was before he went to see the guy and had all this tissue removed. The problem was his bite and infected teeth. We treated his bite, we reestablished the proper orientation of the jaws, took out the bad teeth, and during the process of removing the teeth, I used the laser and sterilized the sockets. Okay, so we're using these tools. I mean, it's like a chef making a fine dinner, and we're just picking whatever he knows what he's got. So that's how we're restoring people. He had a wonderful experience. He went from sleeping 2 hours a night to sleeping 4 and 5 hours a night. Now, I'm not saying I totally cured him. I'm sure he had some other issues, but that made a huge difference in his ability to breathe. What if you can't breathe all night long because you've got sleep apnea? You're going to be constantly acidotic. You're going to be poisoning your body with your own lack of being able to breathe air in. Another story came to me because her holistic practitioner, I don't remember what type it was, but biggest complaint was she was losing her hair. Losing her hair. That particular person had about 12 mercury fillings. I took the mercury fillings out. Her skin problems, which we didn't even talk about, disappeared. Her hair started thickening up. So these are some...
So she had like an allergy to these amalgam fillings?
Yes.
It was causing all of these problems.
She was sensitive to the components of that, and be it the galvanism that we talked about, or just the mercury that was in it, or just whatever. But we cleaned it up, and this happens so fast, you can't just say it's just happenstance. This is really something that occurs within weeks.
And I'm sorry to rush you along. I mean, it's good stuff. Ozone, you're using ozone therapy, which I guess is becoming now mainstream in lots of areas of medicine. How are you using it as a dentist?
I love using ozone. Ozone is one way that we disinfect the tooth. We put a little, we bleed it around the top of a tooth and inside the tooth before we put a filling in. That way we disinfect the tooth. I use it for people that have chronic pain. After a root canal, sometimes years, people say, it still feels funny, okay? There's no particular known explanation other than there's something going on, an injection or two or so of ozone up in the area where the tooth problem is, where the perceived pain is, that just knocks it right out. Usually one treatment takes about 50–60% of that discomfort away.
Is it like a wand where you're shooting the gas in or you're injecting the ozone?
Yes,
or
it's both.
Okay.
It's both. It's just how I want to use that tool has different routes of application. So it can also be used in, believe it or not, in trigger point injections. We can mix it with some micronutrients such as the B vitamins and folic acid and vitamin B12, and we inject it into the jaw joint when there's painful jaw joints, and we can rebuild the collagen. So there's a lot of wonderful applications with ozone, and it's just knowing what those applications are, so when that person comes through the door, you've got it on your tool chest.
Let me ask you this question. So for the people, I mean, certain people, we talked off camera, certain people are better detoxifiers than others, right?
Yes.
Like one guy can, like George Burns can live to 98, he drinks and smokes, and other people can't. Are the people ideal for holistic dentistry? Are those people that have known allergies, people that have a little bit of autoimmune, people that have immune problems? Are those the people that for sure need to see a dentist that's a holistic dentist, in your opinion?
My opinion, yes. Those are the kind of people that you ask who comes to see me, and those are the kind of people that come to see me. And they're on a gradient. You know, some of the people have a little bit of something, other people have more of something, and other people have a great amount of more of something, and they need more help along the way.
So if you have arthritis or lupus or anything like that, right, chronic fatigue, by removing your metal, and I don't want to put words in your mouth, I want to make sure I'm capturing this, but by removing the metal fillings, by giving them safe adhesives for their crowns or whatever, it's one less thing for the immune system to worry about, in a way?
Yeah. So if you think of a bucket, and you're putting drips and drips and drips of water into a bucket, at some point that bucket's going to overflow. Now, holistic dentistry basically takes a big ladle and takes out some of that old water to make and create a good, more open bucket so that you can accept more life issues, toxins from other sources.
Are some people, now people travel distances to see you?
The furthest one I've had was from Istanbul, Turkey. So this gentleman I did 15, 20 years ago was amalgams, was a mercury amalgam removal.
Now I'm reading your book, by the way, because I'm going to get rid of my amalgam fillings. And then I'm realized from reading the chapter, now I'm scared to go to a typical dentist to get, because I guess there's so much that could go wrong when you're removing them.
One of the biggest problems of taking them out wrong is that if you don't do any protection, you know, you practice safe sex in life. You know, you have to do safe dentistry. So part of safe dentistry around the mercury amalgam issue is how are you protecting the individual sitting in your chair?
So you have to have a complete setup
for
the removal of this.
There's a system, there's a
protocol. Can you give me a recap of what you have, like a special vacuum for the vapors?
So we have a whole process. There's about 10 points. We have a homeopathic rinse before and after the procedure. Okay, then we put a rubber dam on somebody. So we have that going on. So, and the rubber dam has only got the tooth that we're working on protruding through it. So now you've got this barrier, like this raincoat.
Okay.
You think of a raincoat with just your teeth sticking up through it. Now, and then we coat that with another chelating agent, and it's gooey, so the particles would adhere to that. So they're just not flying all around. Then we have an oxygen mask on your face so that you're breathing clean air while we're having the mercury fillings removed. I've got a respirator, so I've got I look like a hazmat guy. So I've got a big respirator that I wear to protect me and my staff. Eye cover, you have an eye cover going on. Now, that's around the patient. Outside, we have a huge vacuum we call Snuffy. It's a HEPA vacuum.
All right.
That we have this big vacuum which we put right in front of the mouth. Okay, so we have all this stuff to protect you, the patient, from the stuff going into you, and then we have this to protect our environment, because I have to live in that environment, my working life. And we also have a negative ion generator. So that's blowing from behind us to the catcher.
Does this take hours to do? Or just the same time it would take for any other dentist to get rid of a filling?
Now, the actual physical time on touching the tooth is the same. Our setup and our preparation of the individual that's coming for care so that you have the best chance for success is what we're aiming for. The physical removal of a filling is the same.
Couple minutes?
That part,
Could
sometimes, if that.
Okay.
Okay, it depends on the size of the filling.
The way you were talking, it sounded like a couple of hours. So like a couple of minutes, it could be taken out.
That's right. And so it's, if you're doing a full mouth, that could be an hour, a couple hours. But
Yeah.
if you're doing one tooth, two teeth, you know, and depending on the size of the filling, it's just, you know, if you're only doing this little bit, you know, there's not very much to do.
Okay, good.
Physically. Now, the other thing is that we will go ahead and clean everything up afterwards, and then we do the ozone. Okay, so now we have an open, raw wound in a tooth. This tooth is a living part of your body, so it's a raw wound. So we'll then take the ozone, sterilize and disinfect that, then we put the bonding agent in.
Okay.
Okay, then we thin it, then we put the filling in. And once the filling's in, then we can take everything off. And sometimes we'll take it off sooner, depends. But that's the basic, you've got it now. That's the whole process, right there in a nutshell.
Now, root canals, and we are literally out of time, but you said you do everything in your power to avoid a root canal.
That's right.
In your
we
practice.
We do.
A lot
and
of
everything
bad
else is in the
press
book.
about root
It's all
canal.
in the book.
I got to read the book.
Got to read the book.
I already read the book, but I love that part. One word on dental implants. I guess there are titanium implants, and then there are more biocompatible implants, which are?
There are zirconia implants. And if you test, you may find that zirconia is not helpful for you, whereas titanium is, and vice versa.
So we're out of time, but I guess the main message is if you're going to go to the dentist, and everybody's supposed to go have a dentist, right?
Yes.
You might as well pick a holistic dentist. Is that how you feel?
That's right.
Okay, good.
Yeah. Come in and have a visit.
Okay, good. I want to thank you so much for coming on the program. It's a pleasure. Oh, you told me if for anybody that watches this show, you're going to give them something free regarding your book. What is that?
So the giveaway, if anybody wants, is to go to the website and get a free chapter 1, which includes the matrix, which is
which is your
phenomenal
recipe.
chart. That's my recipe.
For
There's nothing like it else in the world.
Okay, good. All right. Well, thank you. I mean, you love this. Is this the future of dentistry?
This is the future of dentistry.
Okay, good. Thanks for coming on the program.
You're
Always
welcome.
a pleasure.
You're welcome.
You've been watching the Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.